So I'd like to introduce our next presenter, who is Amanda Regis. Amanda Regis joined the Department of Children and Families, Office of Substance Abuse and Mental Health, Statewide Office for Suicide Prevention as a Suicide Prevention Specialist in February 2021. In her current role, Amanda monitors the activities of the Florida Suicide Prevention Interagency Action Plan and serves as the chair of the Suicide Prevention Coordinating Council's Special Populations Committee, and also provides data analysis and conducts research regarding suicide prevention, including evidence-based practices. Prior to joining DCF, Amanda worked with local behavioral health agencies in Tampa, Florida, providing services to individuals with serious mental illness and those with dual diagnoses. During her time in Tampa, Florida, Amanda collaborated with various behavioral health stakeholders, including public defenders, law enforcement, and community agencies. Amanda graduated with a Bachelor's of Arts in Psychology and the Bachelor's of Arts in Spanish from the University of South Florida. And in 2020, Amanda graduated with a Master of Social Work degree with a concentration in adult mental health and wellness from the University of Southern California. So it's my great pleasure to introduce Amanda Regis. Thank you, and we look forward to your presentation.
Thank you. Thank you so much for having me. Are you all able to see my screen?
Yes, we can. Thanks.
All righty. Awesome. So we'll go ahead and get started. So good morning, everyone. My name is Amanda Regis, and I am the Suicide Prevention Specialist with the Statewide Office for Suicide Prevention, housed within the Florida Department of Children and Families. And as was just reviewed, in my role as Suicide Prevention Specialist, I am the chair of the Suicide Prevention Coordinating Council Special Populations Committee. I also monitor activities of the Interagency Action Plan that guides suicide prevention efforts statewide. And I also provide data analysis and research on evidence-based practices as far as suicide prevention. So in today's presentation, I'll be doing a very brief overview of suicide data as it relates to youth. I'll be going over risk factors, protective factors, as well as warning signs. And I'll be going over some of the statewide activities that are targeted towards reducing suicide in youth. So what we'll start with first is orienting you all to the Statewide Office for Suicide Prevention. So the Statewide Office for Suicide Prevention coordinates suicide prevention efforts throughout Florida. And this slide essentially serves to give you all some insight into some of the duties of the Statewide Office for Suicide Prevention. So we do chair the Suicide Prevention Coordinating Council, which is comprised of 31 state agencies and organizations that work toward implementing suicide prevention strategies within their respective organizations and statewide. We also write the annual report, which makes recommendations for suicide prevention activities. And we also develop the state plan that focuses on suicide prevention. And we'll be reviewing that state plan a little bit later. We also maintain the suicide prevention website, which serves as a clearinghouse for all things suicide prevention. The website does have very specific tabs pertaining to suicide prevention related topics, such as current data and crisis information. The website also has some tabs dedicated to various populations, such as youth, Black, Indigenous, and people of color, lost survivors, attempt survivors, and first responders, and of course, other groups as well. We also connect individuals and agencies with resources. So with connecting individuals, in the event that someone is in crisis and they decide to reach out to our office, we'll go ahead and coordinate that for them. We'll either reach out to our DCF SAMH regional offices to get that individual linked to local community resources. And as far as coordinating with agencies, in the event of a suicide attempt or a suicide death, we do help with post-prevention responses to those incidents. So when we're talking about suicide, it's very important that we have a very clear understanding of the terms that we're going to be hearing pertaining to suicide. So here we do have suicide, suicide attempt, suicide ideation. So suicide is defined as death caused by self-directed injurious behaviors with any intent to die as a result of the behavior. A suicide attempt is defined as a non-fatal, self-directed, potentially injurious behavior with any intent to die as a result of the behavior. And a suicide attempt may or may not result in injury. Suicide ideation, sometimes referred to as suicidal ideation, just means that an individual is having thoughts of engaging in suicide-related thoughts and behaviors. So next, we'll be moving on to a brief data overview. I won't spend too much time on that since we did just have a speaker who did a really great job overviewing suicide prevention, suicide data among youth. But I will say that in 2019, overall, suicide was the 8th leading cause of death in the state with 3,427 deaths. And suicide is the 3rd leading cause of death for ages 5 to 14 and ages 15 to 24. Sorry, ages 15 to 19 age group. So in 2019, there were 26 deaths in the 10 to 14 age group and 102 deaths in the 15 to 19 age groups. And this slide just reviews the suicide death rate in those age groups. For the age group of 10 to 14, the rate was 2.2. And for 15 to 19, the death rate was 8.5. Another data source that we use to kind of inform our prevention efforts is the Florida Youth Risk Behavior Survey. And that is essentially a statewide school-based survey of Florida's public high school students. So the results from this survey reported or found that 34% of those surveyed felt sad or hopeless for 2 or more weeks in a row. 16% seriously considered attempting suicide. 12% made a suicide plan, and 8% attempted suicide. So this just really shows how much our high school students are being affected by suicide-related thoughts and behaviors. So far we've gained some understanding about what suicide is, suicide youth-related data, and now we'll take some time to learn about what is being done to address suicide in our youth. So as I mentioned earlier, the Statewide Office for Suicide Prevention develops a state plan that guides prevention efforts statewide. So the state plan is known as the Florida Suicide Prevention Interagency Action Plan, and yes, that is a mouthful. So the action plan is a collaborative document between state agencies and organizations. So here on this slide, you'll see the Florida special populations. Here we have caregivers and persons with disabilities, first responders, and law enforcement, individuals in certain occupations, individuals who have experienced a disaster, and youth. And we consider these groups special populations because they do have a high risk for suicide. And of course, I did want to highlight that youth are considered a high risk population within Florida, essentially based on the information that I shared earlier in the data overview. And it's also known that in Florida, high school females are more likely to attempt suicide, but high school males are more likely to die by suicide. Actually, I just wanted to go back very briefly. The Suicide Prevention Coordinating Council Special Populations Committee. So this year we launched an initiative that addresses suicide prevention in various groups. So thus far, we've created materials for LGBTQ+ adolescents, educational materials for LGBTQ+ adolescents in the month of June in honor of Pride Month. And for the month of August, we'll be focusing our educational materials on suicide, on the intersection of suicide, suicide and substance misuse in youth. And I also wanted to highlight some of the focus areas and the youth-related action items that exist on the Suicide Prevention Interagency Action Plan. So the action plan does have 4 focus areas: awareness, prevention, intervention, and caring, follow-up, and support. Where caring, follow-up, and support is essentially adding a very caring sentiment to follow-up care. So that can look like sending a postcard to someone who has experienced a loss or someone who is an attempt survivor, saying, hey, we're here for you. we have these services offered, and feel free to reach out if ever you need to. And this is, it does seem like something that's very slight and something insignificant, but it's a very significant thing for the person who is either going through the grieving process or is an attempt survivor. So I do want to kind of overview some of the action items that are youth related. So the Office of Child Welfare has leads action item 1.2.2 that says that by June 2021, increase the number of case reviews from 0 to 60 to evaluate involvement, consultative process, and effectiveness of utilization of mental health professionals. That action item has been completed by the Office of Child Welfare. Under prevention, we have action item 2.1.2, led by the Florida Department of Juvenile Justice. The action item reads, by June 2022, ensure the completion of mock suicide drill scenarios that are provided for all staff in the Department of Juvenile Justice detention centers during each shift are maintained at 100% compliance. That action item has also been completed. Action item 2.1.3, led by the Florida Department of Education, reads, by June 2021, increase the number of schools who have completed youth suicide awareness and prevention training by 50%. That action item is in progress and the deadline for completion has been extended. For action item 2.2.1, led by the Department of Juvenile Justice, the action item reads, by June 2022, increase the number of suicide risk screening instruments that are rated as accurate within the quarterly technical assistance monitoring tool from 89% to 95%. And that action item has been completed. And the last action item under the prevention focus area is led by Guardian Ad Litem, which reads, starting January 2021, 100% of new volunteers will complete suicide prevention training as part of their required pre-service training. By March 31st, 2021, update program policies and address best practices in advocating for children who are at high risk for suicide. Excuse me. That action item is currently in progress and the deadline has been extended for completion. And under the intervention focus area, we have one action item led by the Department of Juvenile Justice. Action item 3.1.1 reads, by June 2022, increase referral of youth to a mental health clinician and initiate suicide precautions when suicide risk factors are identified from 96% to 100% in the detention facilities. And that action item is completed. So although we do have action items that are listed as completed, the agencies are still actively working toward exceeding the goals of these action items. Next, we'll go ahead and cover the risk and protective factors. So protective factors are essentially personal and environmental characteristics that help protect people from suicide, whereas the risk factors increase the possibility of suicide, but they may not be the direct cause. So for protective factors, we have things like problem-solving skills. So it's always really helpful to teach skills for dealing with stressful life events, school, and any other problems that may arise. Another protective factor is having a family and community support. A really important protective factor is restricted access to highly lethal means of suicide. So lethal means are actions or items that might be used in a suicide attempt that are likely to result in a death. So those are things like firearms and medications. So it's really important to practice safe storage practices to restrict access to those lethal means before and even during a suicide crisis. So the goal with restricted access to lethal means is to create time and distance between an individual and the lethal means during a suicide crisis. Another protective factor is cultural and religious beliefs that discourage suicide. And lastly, easy access to clinical intervention. As far as the risk factors, history of prior suicide attempts, history of psychiatric disorders, particularly clinical depression, struggling with sexual orientation, a family history of suicide, lack of social support, bullying, and barriers to accessing services. So the goal really is to enhance and increase those protective factors and address those risk factors so that they don't continue to pose that risk of increasing the chance that a person may try to take their life. All right. So the very first step in being able to help someone and being able to help prevent suicide is learning the warning signs. So when I talk about the warning signs, I like to think about them in three categories. So that's talk, mood, and behavior. So for talking, we have things like talking about being a burden, feeling trapped, having no reason to live, expressing hopelessness about the future. And one really major warning sign is talking about killing themselves or having an active plan for suicide, because that would be a direct indication that the person is in imminent danger and that help needs to be obtained. A common myth about individuals talking about suicide is that they're doing it because they're attention seeking and they just want attention. However, we don't get to determine whether or not someone is serious about taking their lives. So we should always just use this as an opportunity to be supportive and helpful in like offering resources in the event that someone is sharing with us that they are having thoughts of suicide. So for mood, mood changes can look like depression, loss of interest in activities that they were previously interested in, rage, humiliation, anxiety, irritability, and just being in unbearable pain. And lastly, for warning signs under behavior, we have withdrawal, isolation, acting recklessly, truancy from school, or lower academic performance. Sleep changes, so that could be either having more sleep than normal or getting less sleep than normal. And lastly, under behavior, we have saying goodbye. So saying goodbye can actually be under talk and behavior, but when it's under behavior, it looks like it can present itself as giving away prized possessions. So if you know someone who, let's say, is very interested in, let's say, collecting items, so maybe baseball cards or comic books, and all of a sudden they're starting to give away those prized possessions, the baseball cards, the comic books, that might be an indicator that the person is having thoughts of suicide. So we've covered the protective factors, risk factors, and warning signs, but what do you do if something happens? So the very first thing you can do when you think someone is at risk for suicide is to ask. And there is a myth that asking about suicide puts the thought in the person's head, and I'm here to tell you that that is absolutely inaccurate and false. And asking about suicide does not put the thought in the person's head. So when starting a conversation about suicide, always be direct. So ask questions like, are you thinking about killing yourself? Instead of asking, well, you're not thinking about doing something silly, are you? Because that second question, the you're not thinking about doing something silly, are you? It has a tone of being judgmental, and probably won't give you the opportunity to gather any information or intervene if that is necessary. So after you're asking those direct questions, you want to listen and respond empathetically. So you want to create a judgment-free zone for that conversation that will allow for open and honest dialogue. So listening and responding empathetically can mean like, can sound like, that must be really difficult for you. I'm here to support you and not judge you. And of course, with that second example, your actions need to support your statement. So if you're saying, I'm not here to support you, I'm here to support you, not judge you, but the tone and the questions that you're asking and the attitude that you have toward the conversation is giving an air of judgment, that's not necessarily responding empathetically. And the next step is to connect them to appropriate resources. So if you believe you or someone is in immediate danger, you can always call 911 or the National Suicide Prevention Lifeline at 1-800-273-TALK or 8255. We also have the Florida Mobile Response Teams, and they provide on-demand intervention services for behavioral health crises. So they assist in evaluation and assessment, develop crisis and safety plans, facilitate stabilization services, and much more. So the Florida Mobile Response Teams are essentially target youth, adolescents, and individuals under 25, but sometimes they do respond to calls for individuals over that age. If you're interested in learning more about Florida suicide prevention efforts, you can always visit our website at www.myflfamilies.com/suicide-prevention. Additionally, the Suicide Prevention Resource Center, sprc.org, and the Florida Suicide Prevention Coalition, floridasuicideprevention.org, also really great places to find helpful information. If I'm ever in need of locating any additional resources that are not available on my website, those are the two places I always visit. And lastly, we have the Trevor Project, which has a wealth of resources for young people in the LGBTQ+ community. And that brings us to the end of my presentation. So I would like to thank you all for having me today and for your time and attention. But before we move on, I'd like to provide you all with the contact information for myself, Amanda Regis, and the director of the Statewide Office for Suicide Prevention, Anna Guy. So Anna Guy can be reached at anna.guy@myflfamilies.com. And I can be reached at amanda.regis@myflfamilies.com. Thank you all again, and I'll go ahead and open up the floor for questions.
So Amanda, the questions are in the chat feature. I'm not sure if you're seeing them.
Okay, let me see. What are DOE action items related to suicide prevention? Let me see. Are the DOE action items related to suicide prevention, suicide awareness and prevention training focused on teachers and staff, and what level of direct engagement with children and youth and their caregivers/parents on suicide awareness and prevention is taking place? Let me go back to the slide with the action items for DOE.
I say to put that together. Should I wait till we're done with questions?
You can go ahead.
Okay.
Okay. So it does look like the DOE action items are related to youth suicide and awareness. I believe that is strictly for the teachers and staff and not necessarily the parents.
This question.
Thank you for that question, Robin. Let's see. If there is a belief in case management and investigations that you cannot inquire about firearms, can you discuss this? Well, in Florida, questions about firearms are always a kind of tricky question to navigate. So I'm not exactly 100% sure what if there are any rules within agencies or within like laws or policies that prohibit questions about firearms. But if you are allowed to ask questions about firearms, I 100% encourage asking those questions, especially if you believe your client or your patient is at risk for suicide. And even if they aren't at risk for suicide, just ask anyway. And how are the Florida mobile response teams accessed? They are accessed by giving them a call. I can link the Florida suicide, the Florida website that has a list of all of the mobile response teams as well as their contact information. I can post that in the chat. Okay, I see that we're posting really great resources from the CDC website as far as protective factors. Great. Okay, really great presentations from Megan and Amanda on the issues of juvenile suicide. We have been seeing the numbers going in our counties, some reported to the hotline and some not. Yes, so we have been seeing some increases in youth suicide, and of course that's why we're trying to be as proactive as possible to respond to those needs as they arise. Alrighty. I think I was able to get to the very last comment by Vicki Whitfield. Do we have any other questions?
One just came in from Merlene. We'll have it posted in just a second.
Okay. Do you conduct a child death review of all child suicide deaths? So no, we actually do not conduct any child death reviews for any child suicide deaths. We get our information from outside agencies. Yeah, so we get all of our information from outside agencies, and it's possible that those agencies are conducting child death reviews, but the Statewide Office for Suicide Prevention does not conduct any review of all child suicide deaths. We do receive reports when there are deaths from our any of our like managing entities or agencies that are affiliated with DCF, but we don't do any actual reviews of the child suicide deaths, if that's what you're asking. And Merlene, thanks for pointing that out. It's really interesting to know that there's someone who you know whose child or loved one could be expressing suicidal thoughts. So now that you kind of have this information in your back pocket, you can always share that with that person and share those resources with them. Awesome, Merlene. I'm glad I was able to help. Thank you so much for sharing that. And if there are any other resources that you need, Merlene, you can feel free to reach out to me. Or if that staff member is looking for additional resources that I don't have listed here, or just wants additional guidance, she can, well, they can reach out to me at amanda.regis@myflfamilies.com.
Thank you so much, Amanda. Thank you for your wonderful presentation and also for making yourself available for our stakeholders to reach out to you, for future questions and for comments or concerns. We definitely appreciate that, and it was a wonderful presentation. We look to working with you more closely in the future as well.
Thank you so much.